what is the composition of breast filler, and is it safe to have breast fillers? What are the long term repercussions or any kind of complications associated which you should be aware of while having the breast filler? This is a very frequently asked question in the clinic. Breast fillers are primarily composed of hyaluronic acid with some addition of silicone type material, some kind of very, I don't want to go into the titty bitty details, but that is primarily silicone to give it a shape and a kind of cavity filling fluid. It also enhances the look of the skin because it is made up of hyaluronic acid. So, what is the risk involved? 99% times I have seen people concerned about it, and that is a valid concern. But breast fillers are just like, any other body filler. Either you have a face filler or a lip filler or a jawline filler, or you have a neck filler or a buttock filler. So because they deplete and they absorb in your skin over next 2 years or 3 years, so they are not going to cause any other hindrance or any other change in the morphology, in the outlook of the cell. Many people ask that, can I breastfeed? Yes, you can breastfeed after having breast filler, because we are not going so deep in your skin that it is going to interfere your mammary gland and mammary ducts to stop you from breastfeeding. Number three, there are some kind of studies which cause some kind of you know speculation in the mind of clients. I think that kind of long term implications are more associated with breast implants, because breast implants, once they are in your chest and in your breast, they are going to stay with you for 10 years, 15 years, 20 years. So there are more and more chances that they can change the local structure of the skin, the local morphology of the skin, and they can cause some tissue damage that can lead to some kind of precancerous or cancer like changes into your chest and breast tissue. But breast fillers are like going to seep in your skin, are going to absorb in your skin in 24 months. And then if you like to top up, if you like to fill them again, it's up to you. And if you don't want to have a refiller, then the breast filler is gone, it's not there. So with the breast filler, in my own clinic, in my personal experience, I have seen clients very satisfied, very relaxed, and there are a lot of choices they have with breast filler. If they want to have some specific shape of nipple, if they want to have some specific area which they want to improve in their breast, if they want to improve the skin of the breast, if it is looking aged and old and full of stretch marks or light of many other problems on the breast, they are all primarily solved by the breast filler. So I don't see, I have not seen yet, and I don't see any kind of dangers, red flags with the breast filler. So you can refill it just like any other filler in the face. So if there are any cancerous changes with the fillers, then the aesthetic societies or the associations world over, they would have banned the face fillers as well, like the body fillers. So they are being used all over the world, and they are pretty safe, and you have a lot of room for your personal involvement, because you have all the charge in your hand. Either you want to refill them, or you don't want to refill them, or you just want to have see how it goes. Number two question is this, that what are the options along with breast filler? What are the non-surgical options out of operation theater? When you want to stay out of operation theater, you want to stay out of the hospital, you want to stay out of those infected areas, uh, we have a lot of options now in this era. We have like Morpheus, we have Scarlet, we have Haifu, we have breast threads, we have lot of latest new technologies for where we take the growth factors from your blood, and we have a lot of DNA therapies which we are injecting into the breast of women while they are going under breast fillers. So we are not only offering breast fillers in this era of I would like to say, where women are having so many choices right now, that they can really enjoy aging, and age reversal is not just a fantasy thought. It is actually it is happening now, and women are taking breast threads, breast hypho, breast scarlet, breast morpheus, and along with that, lot of local DNA reversal therapies which are being injected into the breast, and that are giving them the dream look they want to have for their body. And obviously, uh, this one video is not going to tell you that, what do you want for yourself. For that, you need a very customized and personal discussion with your doctor. We need to sit one on one with each other, and we need to see that, what is your lifestyle, what do you want, what is exactly you're looking forward. And because of my own experience with women in last 20 years, I know personally that not every breast is the same. Actually, the way you have the fingerprint of your hand, in the same particular way, every woman has a unique set of tissues which is only uniquely with her. Not anybody else can own that. So because every woman is different, we need to have different and very customized, very personalized, and very, you know need based solutions and plans for every client. We cannot just ask every woman, okay, you go for breast filler. No, you might need something else for the look you are looking forward. So once you come to the clinic, you actually know that what you along with the breast augmentation, obviously you want to increase the size, but along with that, what you exactly need, work on that, think about that, and what you should be aware of, and what you should be taking care of while you're choosing the aesthetic clinic or the aesthetic facility, or that you're choosing the doctor. That what you should know is this, that don't go for cheap. Never ever go for cheap stuff being injected in your body. If somebody is offering you something cheap, that must be some low grade quality product that has a very high chance of infection, that might not settle down in your body well, that might not give you the results you want, and you might end up fighting and spending a lot of money on the complications and the side effects. So always go with the person who is taking care of sterilization, the sterilization of the area where your procedure is going to be conducted. It, it, it takes a lot of resources, it takes a lot of toll on the clinic to bring you all those sterilization facility. Usually people tell me, I go to that place, they said, okay, lie down and I will give you a filler in 20 minutes, and that's it, and I got the filler, and now I am having this fever and all that. So take care of all those elements while selecting the clinic and the doctor. Somebody who is very particular, I would like to say somebody obsessive about sterilization, and somebody obsessive about having a clean place, clean sterilized area, clean, who wants to have all those SOPs in their clinic. So that's the thing I can, highly advise you while you're choosing for the clinic and doctor. And once you decide to have some aesthetic procedure and you want to go through some major changes in your body, you should be mentally ready to, that it is a one time game. It's a procedure which you take twice or thrice or once in a lifetime. So take a good chunk of money and try to spend on good quality products. Don't go for cheap deals, because they are not going to last. They are not going to last the way you want them to last. It is not possible for somebody to give you Range Rover in the price of Mehran or Corolla. I think that's pretty simple. You can understand that. And if you want to have a filler to stay with you, without any infection, without any fever, without any rejection, without any transplant, it is also a kind of implant. When you fill in the filler from outside sources, then you should go for the most good quality fillers. When you go to a doctor, ask for quality, not the price, because this is your body. And if you want to stay out of side effects, that's the best thing you can do for you. And I have seen excellent results when the client is very comfortable in choosing quality, when the client is giving us the room to give her the best, then we enjoy the process as well. And we like to do it for you, because we are artists. Aestheticians are like artists. We are making in the process of a masterpiece, so we like to have the best colors, the best products. So, and that was my take on all that.